What my project will be on is one of my patients that I received. Name is Sandy Bushman. Sandy Bushman is 74 years old. This patient wound up being extubated due to the fact that he was actually intubated due to deep venous thrombus complications. Now is having problems with his allergy-based asthma, so and is currently being treated. This patient would definitely be used as a template as to how we can go about treating each one of these disease processes and coming up with a care plan and a take-home plan for patients who do have these complications, whether it's post a procedure or due to the season change and them having an asthma exacerbation that's uncontrolled, which unfortunately Sandy Bushman actually do has a history of uncontrolled asthma. So we're definitely going to talk about that. We'll go ahead and talk about how each disease processes began, how it manifests, what it eventually turns to the point where life support is definitely an option and is needed. Um, we're also going to try and educate the families about each of these disease processes and what they can do to be a part of the process of healing their loved one when they come in, like unfortunately Sandy Bushman, and wound up having to have a hospital stay. Whereas this can, if not be prevented, the symptoms can be lessened to the point where this type of intervention would be necessary. And I think that's what we need to get from this video. But this would be great for Mr. Bushman because Mr. Bushman is a chiropractor who owns his own practice and works at least 1 day a week. So Mr. Bushman's gonna definitely want to get back to work. So what we need to do is come up with a plan to get him back to work so he can get back to his daily life. That being said, Mr. Bushman does have he does have some significant smoking history along with that. He's also had a heart attack and stents along with other things. So when I do say get him back to his daily life, I'm going to mean it relatively, and we're going to try and get it to a point where he can control his symptoms of his allergy-based asthma effectively, and we can definitely reduce him having to come in and get him back to a regular life. So that being said, I will start with some slides. We'll go through the disease processes, and we'll go from there. Thank you, guys. Asthma is a chronic lung disease. The normal etiology of it would be it would cause inflammation of the airways, depending on what the trigger is. Unfortunately, in Mr. Bushman's case, the trigger was an allergic response. Um, this allergic trigger caused inflammation throughout his airways, which led to the uncontrolled asthma exacerbation. Again, what our goal is here is to ultimately find out how we can, if not prevent the trigger, reduce the symptoms effectively. But asthmatics normally have pretty sensitive lungs, and the lungs respond differently depending on what the triggers are. And it isn't just one trigger, of course. The triggers can be due to exercise, can be to a viral cold, infections, allergies, it could be just due to smoke and also the weather change, which is pretty common, which is why we tend to get a little busier during the cold season. Brings in a majority of our kids and um, even our adults eventually. Um, and normally asthma attacks, um, they're normally presented exactly as I said, as attacks, but pretty fast, pretty acute. Um, so we definitely need to hop on it right away when we do have asthmatics that do come in because the attacks can turn into severe asthmatic exacerbations, which will lead to their airway eventually clumping down just due to the inflammation and they're not able to really oxygenate and get in the air. There are many common symptoms when acute asthma attacks are normally manifested. Many patients will normally complain of a chest tightness. There could be audible hypersonic wheeze, um, and that would be accompanied by difficulty breathing, retracting, accessory muscle use. You might even see some nasal flaring and definitely retractions. Respiratory rate going up is normally a way of compensating, so you would definitely see an elevated respiratory rate along with a elevated heart rate. That's normally how asthmatics actually compensate, and it's normally not due to the fact that the airways aren't able to actually receive air. It's more of them being obstructed and unable to actually get them out. So we do treat that. Frontline drug would be albuterol. We do that by reversing the bronchospasm process, and we dilate the airways to return them back to their regular size. Um, though albuterol is a frontline, that could be accompanied by Atrovent, or tripibromide is another common name. Steroids are definitely good, especially via IV for um, asthma attacks. Are going to take a little bit longer to be effective. So bear that in mind. That's why we do use albuterol as a frontline drug. And also, the most important thing when we're trying to treat asthma is actually eliminating or even identifying a trigger, because sometimes we actually don't know the trigger of the asthmatic attack, which could definitely cause us some complications down the line. Now, pertaining to Mr. Bush, we knew this was an allergy-based attack, so we were able to identify the trigger. All that was left was to treat the actual symptoms, which was the wheezing, the difficulty breathing, and we did that by supplying steroids and also giving dual neb, which is albuterol and Atrovent. So that being said, we'll go ahead and move to our next disease process, which actually led to him being intubated, which is deep vein thrombus. Mr. Bushman was intubated due to some issues as far as deep vein thrombus goes. It kind of manifests as far as it's normally like a clot. It forms deep in your veins, normally somewhere in your body. Specifically, it'll normally occur in the legs, but it can occur other places. And it's actually pretty easy to come across this process because it can happen when you don't move a long time. And as we all know, I mean, you think about how many of our ICU patients, how long they actually sit there in the bed, especially the ones that are intubated for weeks on end, are unable to actually get up, move around, exercise, stretch their legs. So it's pretty easy for these clots to form. Unfortunately, these clots are very fatal. Once they break loose from the veins, they'll just travel through your bloodstream, and they can actually attach to your lungs and block the blood flow, um, which happened in Mr. Bushman's case, unfortunately, which led to the shortness of breath and him being intubated. And unfortunately, when patients get to that point where they need to be intubated, there has to be some kind of intervention as far as the clot itself. Though we may be able to take over the work of breathing and sedate the patient, that doesn't change the fact that we have an occlusion, um, and that needs to be treated, and that's going to lead into our symptoms and treatments segment. But Mr. Bush was unfortunately a victim of having a hip surgery at his age, which led to him being immobilized, which eventually led to the clot. And at 74, to have some hip issues versus someone who's like 35 is definitely something to consider when having surgeries and possibly to get them on blood thinners ahead of time. So we'll go ahead and move on to our treatment options. Alrighty, guys. So as we're moving along, so we're on the treatments and symptoms as far as DVT goes. Um, Normally the swelling, you'll see possibly some swelling on the affected leg, not all the time though, so don't definitely rely on that presentation. And there can even be swelling in both legs. Um, but normally they'll complain of some kind of pain in their leg, and it could start in their calf and almost feel like a cramping or like a soreness of some sort. Um, like I was saying earlier, you're gonna go ahead and treat that with some blood thinners, medications, and Mr. Bushman was actually on, I believe, warfarin and Coumadin um, while he was on during the procedure itself, and possibly after. Um, and unfortunately, he still developed clots to where he had to be intubated. So blood thinners won't always save you in a sense. Um, and some people even eventually, after they're on blood thinners for a while, they may have to get some IVCs, which is another type of filter um, that they go ahead and put to prevent the clots from getting to the heart, which could definitely be a viable option for sure. Um, and they'll insert this in a large vena cava, and also it could possibly go in the abdomen, and it just prevents them from breaking loose and basically lounging in your lungs itself. Also, definitely more a extreme option if again you're on the thinners and they're not really being effective, and you're at a high risk for forming clots. Then yes, you would definitely be having to most likely undergo a filter being in place. Um, this definitely is an effective treatment, and it's been proven to work time and time again. But as far as in Mr. Bushman's case, he still wanted being intubated, and all these symptoms weren't actually exhibited when he presented. It was only the shortness of breath, so that's what makes these clots really hard to find. And unfortunately, normally we'll send the CT with some contrast to try and see what's going on when it gets to that point when it's in the lungs, and then we treat it then. So it's actually really important when you're getting these procedures and you're thinking of age, because the older you are, the less like you are to recover as fast, and less like you are to move, which is why therapy, physical therapy, is so pertinent when it comes to the recovery stage after these surgeries and getting your patients up and ambulating, especially when you think of our cabbages and other types of patients that are immobilized, and we think of how long they're immobilized, especially if you're 76-year-old and get a triple bypass. Um, you definitely might not recover as quickly as someone who's 50. So all these are really considered, already considered normally when patients undergo procedures, and these are normally talked about to the family, the risk and all. So I hope this was helpful. I know it's pretty broad, not really so specific, but I hope out of anything that you learned is that basically some clots can be really hard to identify, and they can be asymptomatic. It can just present as shortness of breath, which is what happened to our Mr. Bushman, and what he needs to do if he's ever to undergo other procedures, possibly to get the filter put in, just because he's already at a high risk because he had clots and they already were lunged in the lungs, and he's already an older um, patient, so he's going to be at high risk for clots. So these things need to be considered as preventative measures. Thanks, guys. Alrighty, guys. So this is my last video. Thanks for watching. We talked about some pretty cool disease process. We talked about asthma. We talked about deep vein thrombus. Most important thing with asthma and for Mr. Bushman is, again, what are the identifiers as far as what are we identifying as a trigger? How are we going to treat this trigger? How are we going to prevent this trigger? And then not only that, we need to talk to the family about what these triggers are so that we can not only help him out, but we're helping the family out by explaining why this is occurring, and so it can definitely be prevented. Because again, we can do all we can while he's here, but at home, there's got to be a change in what the trigger was. And for him, it was an allergy-based trigger. So depending on what the allergy was, whether it was a food allergy or a cat or whatever it may be, getting rid of the pet or not eating that food that caused that allergic reaction is the best course of action. Depending on what the allergic reaction was caused from. So, and then we went on and talked about his deep vein thrombus issues as far as his clots. He was high risk. He was already 74 years old, and it was a hip. I mean, 74 years old receiving a hip procedure, recovery is going to be so long. So, definitely some preventative measures had to be put in place before the procedure was even happened, and then along with that, he needed to be compliant, and there needed to be an education done on that aspect of why we're doing this, why we're giving you this lesson plan. So again, getting him on the blood thinners ahead of time before maybe considering the filter ahead of time. These things could have been implemented to prevent the intubation and his long ICU stay, which still left him immobilized. So that being said, again, thank you guys for the video. Had a great run. Appreciate the year. Hope you enjoyed it, and hope you do well on the test. Thanks, guys.